Originally, I wanted to actually be a cardiologist, and I started doing my PhD with a group of physicians, one of whom was one of the world's greatest heart surgeons, and that was it. I sort of decided that was the coolest thing I'd ever seen and that I was going to be a heart surgeon. I'm Michael Ibrahim. I'm one of the attending cardiac surgeons here at Penn. I treat people who have valve disease requiring reconstructive approaches, so valve repair. I use robotics to do operations through extremely small incisions, and also replace valves with living valve options like the Ross operation, which is not offered in many places. And the other hat that I wear is a heart failure surgeon putting in artificial hearts and doing heart transplants. I deal with really the breadth of cardiac surgery, so patients who are quite well with one valve disease problem but are minimally symptomatic, and those are the sort of patients that we offer minimally invasive options to, robotics and things like that. I also deal with people who are considered inoperable in many hospitals, who have multiple valve diseases, who have failing hearts and valve disease, or who have multiple reoperations. I think I form a very close relationship with my patients. I tend to view them through the prism of my own experience being a family member of a patient and feeling sometimes frustrated about the lack of information and communication, and so I always am very sensitive to that. So I like my patients to feel that A, they're the most important person that I'm dealing with, and secondly that I'm always available, and that they're getting the best possible care, but also the most comprehensive understanding of their problem and what the options are to treat it. We have really one of the best divisions of cardiovascular anesthesia and intensive care in the country, which allows us to comfortably do these very complex operations that require intensive care at a high level, and also partner with some of the best cardiologists in the country. People who've led the major organizations for cardiovascular medicine and surgery are at Penn, and their leadership has really shown in the structures that we have and the care pathways that we have for the most complex disease patients. No good heart surgeon doesn't enjoy operating. I think if you don't enjoy it, you're not good at it. So I get a real thrill and joy from operating on the heart, but I also love speaking with my patients. And then I love seeing them afterwards. Luckily, most of my patients do extremely well, and so that's a very joyful experience.